So in this video I'll share different ways to develop themes, and in the process I'll share a number of pieces of advice for what to do, for what not to do, how to name the themes, how codes become themes, etc. So I do advise you to watch the video in full, because there may be things and maybe advice that I give that is not directly reflected in the topic of this video. I wasn't sure how to name this video, to be honest. So I'll just show you the process and just show you how I work with themes, and this is based on my students' feedback, so I know there will be plenty of valuable things in this video. As you'll see in a second, I'm using NVivo. I created an example dataset for the purpose of this presentation, but do not worry if you don't have this software. So whether you're doing your coding manually, or maybe using another software, or using Microsoft Word, which is something I have a video about as well, do not worry. This is just for the purpose of presentation. I do use NVivo, but you don't have to do it. So the whole purpose of the video and all the advice I give still applies if you don't use this software. Okay, so now let's jump straight to our data analysis. So as you can see, and as I mentioned before, I'm using NVivo. So if you're not familiar with this software, don't worry, I won't be going into details of this software because that's not the point of this video. But if you are familiar with this software, then it's even better, and you may treat this as an additional NVivo lesson. But anyway, before we start, so as I said, this is a practice data set. It's a hypothetical study. So let's imagine we're doing this study. The study is about mental health provision and availability in Saudi Arabia. So I'll read out our hypothetical research questions. So research question 1 is, what are barriers to mental health access and provision in Saudi Arabia? And research question 2 is, how to improve mental health services provision and availability in Saudi Arabia. So basically the study is about access to mental health services, about the barriers, and about how to improve this access in this particular context. And this is important because these research questions will determine the way I think about themes. As I said in the previous video, as one point when codes, the transition between codes and themes, or shift from codes to themes, occurs when we take our coding and we start thinking about our research questions. That's when we decide which codes are relevant, which codes we need to delete because they are not relevant. Sometimes we join a couple of codes, so that's when we start thinking about our research questions, and that's one of the points when a code becomes a theme. Although it's rather hard to determine. There is no one point that says, okay, this is a theme now, but these are the guidelines that I kind of developed and follow myself. Okay, so now you can look at the list of my codes. I would say that what we have here is something that happens very, very often with my students. So perhaps I would not be surprised if you are at this point you have something similar. So it's like a mixture. It's a little bit of codes. They are organized to some extent, but you're not entirely sure what to do with these codes, whether to keep them all, whether to rename them. I would not be surprised if you are at this stage, because as I said, I do offer private tutorials, link in the description. I do offer private tutorials, one-to-one sessions in which I work with students, and very often, every week, believe me, every week, literally, I get students who come to me and they show me their data set. They feel stuck, they feel like they are worthless, they don't know what to do, and they're completely lost and they need help. And what happens is I look at this data set, and quite often they are almost there. It's literally the data set needs maybe 15 minutes of work in order to become a proper thematic framework. So this is a good news, and I love sharing that good news with these students. Perhaps you are at the same stage. So basically, as I said, this is a mixture of different codes. So this is somewhere I would say, in the middle stage of data analysis, where you have coded. This is not a video about coding. There is another video about coding. This is a video about generating themes from code. So I have these codes, and I even organize them to some extent, as you can see. So I have, remember, this is about mental health provision, right? Mental health access provision. So people who, let's imagine the people in our study, they struggle from mental health problems. So as you can see, there are a couple of mixed codes really here. So first, symptoms, effects on social life, seeking help, effects on family, stigma. A couple of things that you can imagine would be mentioned in this kind of a study. And then there is some attempts to organize some more of these codes. So you can see effects on own psychological well-being, constant embarrassment, stress and anxiety. There are obstacles, negative experiences. This is important. So this will probably be about our barriers. Obstacles, barriers to mental health provision. And there are good things and what helped. So you can see reading books, having a female doctor. It's Saudi Arabia, so perhaps that would be that's why it would be a factor. Friends you can talk to, empathetic and caring doctors. So you can see there is some organization here. So now let me explain what's going to happen in the remaining part of the video. I'll show you two ways in which I would work with these themes. This is to show you that the process of generating themes is a very flexible and very subjective process. You are in charge of your themes and you can decide which way to go. So in the remaining part of this video, I'll show you two ways to organize this into a thematic framework, and both of these ways are correct, importantly. So there is no right or wrong. So before I start organizing this into these two different ways, a couple of basic rules, I would say, for creating themes, and something I always say to my students. So the first rule, something we will apply into practice in a second, when, and I've said it many times in other videos as well, when a reader or somebody looks at your thematic framework, he or she needs to know straight away a couple of things. Thing number one, what your study was about. So by looking at your themes, he or she needs to understand what you are looking for in your study. So by looking at your choice of themes, what you decided to keep and not keep, he or she will know, okay, he or she was looking for this and that. So the reader is looking at our thematic framework here. He or she is not entirely sure what it's about. So I think you'll agree with me. There are some good things, some obstacles, but we don't really know that much about obstacles to what, good things about what. We don't know that much from looking at this. So that's the number one thing about thematic frameworks. The number two thing is it's really very similar. It's that it needs to be self-explanatory. So generally, when I look at the themes, again, I need to understand their place, their role, and what they are referring to. So have a look before we start to create these two separate thematic frameworks. Let's sort out some common problems with this. So have a look here, for example, the cost of treatment. This is a very common problem with the thematic frameworks that my students show me. So the cost of treatment. Again, as I said, as a reader, if you're not familiar with this study, you'd ask yourself a question, cost of treatment what? What is it? Is it a good thing, a bad thing? It doesn't tell me anything at all. The cost of treatment. I just know that this was about a cost of treatment, but I have no idea whether it has any meaning and any importance in my study. I know, because I developed this sample framework, I know that the cost of treatment was one of the barriers to mental health provision. So the moment I put it here, I'm going to move it to obstacles and negative things. You can see it's somewhere here now. It kind of starts to make sense already, because now I'm looking at, okay, obstacles, negative experiences. The cost of treatment was discussed as something negative. It's a little thing, but as I said, I'm surprised at how many of you, how many of my students struggle with this. So they have these themes, but the simple thing that they don't do is putting it under a respective category, putting it somewhere where it makes sense to the reader. So when I look at the rest of this, I can see another thing: effects on family, effects on personal life, effects on social life, and here we have effects on psychological well-being. Something tells me that at this stage, this early stage, again, what I can do is to create something that says effects of mental health, maybe effects of mental health, that's it. And here I want to move all the effects, everything that talks about effects, even this one. So basically what happens now, I have this, let's call it a theme now, effects on mental health, and here I have effects on social life, I have effects on family, on professional life, on psychological well-being. It's already a little bit more organized. So now I kind of start to have something meaningful here, although I'm still not sure about some of these. I would say public stigma will probably end up as a negative things. Again, I can imagine because of public stigma people don't seek help, they pretend that they are okay. Seeking help for symptoms and history of illness, not sure what to do about that at this point. But what I know is that it already looks a little bit more organized, so now I'm ready to start working on our 2 versions of a thematic framework. So again, as I said before, I'm using NVivo. Don't worry if you're not using NVivo. But if you're using NVivo, I do have to tell you what I'm doing. So these are in my initial coding folder. So usually I just create something, a new folder. Let's call it Thematic Framework version 1, because I'll show you 2. So I want to keep this initial coding here just for the future, just in case. So I'll copy it, I'll move it, I'll paste it to my thematic framework folder, and this is where I'll be working on my new framework, on my thematic framework. And I still have this here, so I can always come back to it, to the original version. So in version 1 of my framework, remember now, let's go back to our research questions. So what are barriers to mental health, access and provision? That was my first research question. And the second one was how to improve mental health services and provision. And this will be important now. So look at this, what I have here. I have good things and what helped. So it's everything, all the codes about generally good things, right? What helped with mental health provision and access and service and whatever. Support from family helped. So somebody had family, you know, who's supportive. Doctors who were knowledgeable helped. Support from friends, reading online materials, reading books, a family who understood the condition, so it's kind of like supporting family. Empathetic and caring doctors, friends you can talk to. So all of these things are what helped this person. Now if we think about our research question, how to improve mental health service provision, I may decide, and I don't have to, but I may. So as you'll see in version 2, it will be a completely different theme. But this is one of the scenarios. I may decide, okay, I need this theme called Ways to Improve Mental Health Service and Availability and provision, or whatever. Ways to improve mental health service and availability. This will be my theme. In this case, what happens is I'll probably pick most of these things will be relevant. So I can, these people were talking about what helped them in their experience. But because my research questions are about ways to improve, I will turn these into ways to improve. So if somebody says doctors who are knowledgeable helped him or her, I will say ways to improve is to have knowledgeable doctors, right? So I'll say perhaps ensuring that mental health professionals are educated about I don't know, different conditions. So as you can see, I turned, it's such a small and subtle thing, but it's extremely important, and something that I always want my students to understand as well, that you don't always have to take something literally from what your participants said. So they said, they were talking about their experiences and what helped them, but because you're focused on ways to improve, again, as I said, I know I keep repeating that, but you want to turn, I decided in this case to turn this into ways to improve. This is my theme, and what they said, what helped, whatever I can, I will turn into ways to improve. So I'll take that and analyze and think, what does it tell me about ways to improve? Support from family, let's leave it for now, friends as well, but reading online materials, reading books, learning about the condition from the TV. What does this tell me? Somebody was educating themselves from books, from online materials, on internet, watching TV. So to me, I'll just create now a new code or sub-theme. To me, what all of these say is really about educating yourself and raised awareness. So people were, self-educating, they were gaining access to certain materials. So I think it's about awareness, so raising awareness of the condition or whatever, and how and where to seek help, maybe, if that was the case. Of course, remember, this is just an example, but so now this is a new theme, but now I need to, again, only if you're using NVivo, now you focus on what I'm doing. If you're not using NVivo, the point is to just join these into one, so into raising awareness, because this is what this tells me about what happened. They were becoming aware, they were self-educating, so perhaps raising awareness or making sure that there are materials for general public, anything like that. So I hope you start to understand what I'm doing here. So empathetic and caring doctors, so maybe again just training or increased training for doctors, or training regarding empathy or how to support your patient, networking with other people affected, so provide ways to network, so I'm pretty sure by this stage, by this point, what I mean, so what I'm doing here. Mind shift into not seeing this condition as something shameful. So what about this mind shift? What does it tell us about ways to improve it, this availability and service? So perhaps it is about raising awareness. So we could either break it down into more detailed sub-themes and talk specifically about this mind shift. So giving people tools to undergo this mind shift, or this can be something general. Again, it may be just about raising awareness, because if you're aware, you're likely to have this mind shift of not seeing this as something shameful. So this is basically what I mean. So this is what I'm doing, and this is the first very important lesson from this video, that you can it's not always creating themes is not always about this surface meaning. It's digging deeper than that, and seeing something beyond the surface level, and sometimes interpreting something and thinking about, and this is very important, I keep saying that, and I will keep saying that, because it's so important. When you create themes, you're thinking about your research question, and that's what makes a difference. That's what makes a theme different from a code. Now there are a couple of other things. I don't really want to bore you to death with this. I would probably have to really think about, let's say, support from family and support from friends and all this. Is that I understand that this helped this individual person or a couple of people, but is that something what does it tell us about ways to improve? I don't know. Surely it does tell us something, but you'll probably have to be creative and really think about it. We can argue, I guess, that it's still about raising awareness, because if you have this general public aware and understanding that this is nothing to be afraid of or ashamed of or embarrassed about, then again it's more likely that people will be supportive. So perhaps it's about raising awareness, perhaps it's not, perhaps it's you don't even want to keep it. In that case, you simply delete it. Sometimes it happens. This probably would not happen with these particular sub-themes. I would try, because they were quite big, so to speak. I could see that quite a few people mentioned that. So I would probably be reluctant to delete it whatsoever, but sometimes I do need to delete things. So having a female doctor, so I'm guessing this would be some female talking about her experience. So then again, have more female doctors maybe, or to make sure that female doctors are allocated to female patients, or whatever you want to make out of it. So a family who understood the condition, I'm just going to delete it for now, but again, it could be about raising awareness. Friends you can talk to, same thing, and family again. But I hope that you see the point. I'm not saying I would delete all of it, but I'll probably think of how to rename these themes. Another thing that I'll do here, of course, is just rename this. As I said before, obstacles and negative experiences doesn't tell me that much. It's just a code, so it's a note to myself. I created it. I have every right to name it whatever I want to. You can watch my other video about creating codes, and you'll see ridiculous code names that I create sometimes. But here at this stage, I'm already thinking about a product that I will show to somebody. So I want it to be clear, as I said, that person needs to understand what I found, what my study was about. So this will be barriers to mental health, access, and provision. And here, as you can remember, I have certain barriers. I have stigma, cost of treatment, lack of knowledge. So let's just keep them the way they are now. But perhaps I would do some work and perhaps I would rename some of these things. I can see there are quite a few barriers that are about doctors, and quite a few barriers that are about the person's conditions of being afraid or lack of knowledge. So perhaps I would create internal and external barriers, or maybe barriers related to doctors and then related to the patient. It's completely up to you what you want to do at this stage. But now you can see we have ways to improve mental health. This is directly relevant to our second research question. We have barriers, which are relevant. We have effects of mental health. I would say, again, you can delete it. You don't have to keep it, but there is quite a lot about these effects. I would call it an emergent finding, and I would find a way to incorporate these effects into my discussion. I would probably start with the effects. I would say that the participants talked about the effects on their life. This is an important issue. We have to investigate it because they explained how it affected their professional life, their family, their social life. So there is a huge effect of the condition on their life. At the same time, they talked about barriers and what prevented them from seeking help. So it is important to think about ways to improve mental health service. That's how I would probably discuss these findings in my chapter. Another video that I will link to is specifically about how to present the findings. And now finally, history of illness in the family. Do I need that? Perhaps not. Perhaps not in this particular framework. I'll show you in framework version 2 that this will be important. But seeking help, how they sought help. Let's say I may or may not decide to keep it. At this stage, I probably will delete it. First symptoms is some demographic information. If you find something relevant there in your first symptoms, discussions of first symptoms, go ahead and use it. Or maybe you can rename it. Maybe you can recode it as something else, or some, challenges. I'm sure when they talk about first symptoms, they talk about, being lost and maybe, not being sure where to seek help. So repurpose these codes. Otherwise, delete them. First symptoms doesn't tell me much. If you imagine a framework or a visual model or something based on these findings, what does first symptoms tell me or the reader about the findings? Nothing. I'm pretty sure as a reader, I'm not surprised they talked about first symptoms, but unless it helps me understand your findings and helps me again, and helps me answer your research questions, I don't need it. I don't need first symptoms. And history of illness, we'll see. I have a feeling it has something to do with the support from your family, for example, which again will be more relevant in our version 2. So I'll delete this as well. So now we have, let's call this our final thematic framework for at least our version 1. Now let's quickly do version 2. I'll copy and paste this again. And stick with me because I think this will be quite interesting. Of course, considering that we're doing data analysis, it's not that interesting in the first place. To some people it can be interesting. Anyway, okay, obstacles. Again, I'll just call them, you know, barriers to mental health, provision and availability. As I said, it's completely up to you how you want to approach these. I would most likely, I like to have sub-themes. I would probably have some kind of division, as I said before, internal, external, something like that. And now effects on mental health, of mental health, I would probably keep this as well. And now our good things and what helped. So, here. This time I'm taking a completely different approach. I'm not going to turn them into ways to improve mental health services, because actually I see it as I decided at this stage that if I do that, if I turn them into ways to improve, I have to, as I show you before, I'll have to get rid of some of the codes, delete some of the codes. Maybe I don't want to, maybe I want to keep them all. This is not to say that the first version was wrong. It's something I often do, but maybe I want to do it, you know, another way. So, and this way is also correct. So this just shows you, I guess, how flexible a process it is. So this time I want to call this factors that benefit mental health, access and provision. Okay, so now we don't have to change the wording that much, as you can see, because you know, when we talked about ways to improve, as I explained, some of these had to be reconsidered, because how you know, friends you can talk to, what do we do about it, what do we do, how can we ensure that they have friends to they can talk to. But now it's changed. Now it's about factors that benefit this provision and access, and as you can see, it makes sense all of a sudden. So it makes sense because friends you can talk to, it's a factor, right? So, but here again I would definitely introduce another categorization. I would call this external. Just like I said, I love external, internal categories. I quite often create these for all kinds of studies. Internal. So external, internal, support from family. External, I guess, doctors who are knowledgeable. External, support from friends. External, family who understood the condition. Having a female doctor. I don't know, empathetic doctors, friends you can talk to. Being supported by the family. Let's say all of these are external. You'll probably argue about some of them. But then reading online materials, reading books, mind shift, networking with people, learning about the condition. I'll call this internal. So now I have, as you can see, it's a completely different approach. I didn't delete any of these, and I will still use in my discussion, I will still use these as ways to improve. I'll explain based on whatever I can. Especially I would say external factors, but not exclusively. I will still use them to discuss possible ways to increase or improve that mental health availability. Now, if you're using NVivo and you're worried about these numbers here, 0 and 0, all you can do is right-click and aggregate coding from children. So now you have actually a representative number of these, and I'll do the same for the main theme, aggregate coding. So it doesn't have to say 0. If that's something that bothered you, that is. So what else do we need to do here? Remember, we have these codes. So first symptoms, again, seeking help. Again, arguably I may delete them. In practice I may or may not. Maybe if I find something relevant there, especially seeking help, that I have a feeling based on my experiences with data analysis, that I would probably find something there that's about barriers, but for now I'll delete it. However, this time history of illness in the family, I want to keep it because let's say, again, it's all hypothetical, but imagine that under this theme or code or whatever you want to call it, the participants talk about their families' experiences, previous experiences with illness, with mental illness. I can imagine that this is probably a positive factor, or a factor positively influencing their experience, because if their mom or their dad had experiences with mental health provision, they probably don't have this stigma or whatever. So we had all these barriers. We had a family trying to normalize the symptoms, trying to they being ashamed of their child, of admitting their child is mentally ill. And this is by the way real. These problems are real. I've worked on several studies related to mental health, and these things are real, so I did not just come up with them. So imagine, so you have these families that don't accept that, sometimes they don't even accept and tolerate their child anymore as their child. So I imagine history of illness in the family is probably something that positively influences this, this situation, because they are more accepting and supporting. They are also more knowledgeable about the condition. So most likely I will, when I think about this theme, I will either add it to external, just as it is. I'll add it to external factors that benefit the provision and availability of mental health, because, like I said, because of what I explained. Or maybe I'll incorporate it into support from family, or family who understood the condition. So let's I can decide to do this. So cut and paste into family who understood the condition, because if there is previous history of this condition, then most likely they understand the condition. So this, but again, you don't need to cut and paste it into that theme. You can keep it separately. So all of this just shows you again how flexible a process it is. It all depends on your decisions and how you decide to organize your themes, what you decide to talk about, how you interpret these findings. So this is especially the case for what I showed you, the difference between version 2 and 1. Version 2 just took everything as it is and then further categorized these factors that benefit into external, internal. Version 1 completely changed these factors into ways to improve mental health service, and this also required us to reword a lot of sub-themes. But both of these ways are correct, and you can do whatever you decide to do. As I said before, and if you struggle, feel free. I hate to do that. It's blatant self-promotion, but here is the link. If you struggle, you need help, you feel like you need help, feel free to contact me. There is a link. Write me an email, describe your situation, I will try to sort something out. By that I mean, of course, having a one-to-one session in which we'll work on your data. But I'm not saying you have to do that. I hope that using these videos, these free videos that I post, you can find your way around it. Because like I said, many people seem to be stuck on something that is exactly what I showed you in this video. They have it. They have almost all the structure there. They have all the components there, I'll put it that way. They don't have the structure there, so they just need to build something with these components that they have. So that's all. I really hope that this video helped you. I hope that you learned something new. If you have, please like the video or share it with somebody who may need help. And I'm planning to keep recording these videos where I just work on my themes and show you all these different elements and all these different pieces of advice.